Sometimes while I'm out on this walk during lunch, I have an idea that I want to cover, or a topic I want to discuss, or a video I want to cover to inform you all what's going on. And you may be wondering, why is he picking lunch to do this? Why is he doing this on his walk? Well, sometimes I think it helps to get outside, get some vitamin D, soak up some of the sun, and be in a different environment than just seated and talking about one thing after the other. I want to be out moving. I want to be out kind of showing you all what real life looks like and how it works as far as my schedule goes, and being able to just appreciate some outdoor nature and air while the weather's still nice at this time. It's a different change of scenery, and I think it mixes things up a little bit. So I hope y'all like it. And I've honestly thought about too doing some live stream Q&As during lunch, like if I'm on a walk or whatnot. So if that's something you might be interested in, let me know in the comments, and let's see if that something sticks or try something different. Because there's a lot of good questions that need to be asked and some things that need to be discussed. I don't have all the answers either. I like to ask questions too. So it's good to learn and grow from one another. In this video, I'm going to be talking about diabetes and eyesight. How are the two related? How are the two connected? What problems do they cause? The type 1 or the type 2 diabetes? And what can you do about it? So let's start from the beginning. So type 1, type 2 diabetes can affect the blood vessels, and specifically the blood sugars, A1C, the amount of sugar that's running around in your blood vessels that your liver and your pancreas should be able to break down and process. But sometimes there can be some difficulty with insulin resistance, insulin production, different things like that. I'm not going to go into the specifics of diabetes, but we're going to talk about how it affects the eyes. So the way diabetes can affect the eyes goes like this. You have blood vessels, veins, arteries, capillaries that all come into the retina, right? So they come in through the optic nerve, they come behind the retina, they supply your retina with oxygen, and they take carbon dioxide out of the retina because it's part of every metabolic process that every cell in your body goes through, whether it's the retina, the brain, the leg, the foot, the skin, anything, organs, you name it. So let's go back to the blood vessels, veins, arteries, and capillaries. When under extreme stress from blood pressure or blood sugar or changes in A1C or anything like that, that can cause problems with vision. So if your blood sugar is unstable, if it goes like a roller coaster, like up and down consistently, you're not monitoring it constantly, and it fluctuates wildly, that can present some problems for how you see. Your prescription might change. Your eye's health will change. The blood vessels themselves may actually leak in the retina, and you can have hemorrhages, you can have broken blood vessels, you can have, if it's there for a long enough amount of time, neovascularization, which is your eye thinking that it's suffocating and that it needs to make new blood vessels in order to get things healthier and back to normal, which it doesn't. It's just trying to help fix a problem that is currently there. So the blood vessels, we can see cotton wool spots, which almost looks like you take a piece of cotton, stick it in the retina, and that indicates that there is some blood vasculature problems that are not getting the correct amount of oxygen to the retina and the photoreceptors that help you interpret your vision and see the world in front of you. There's a lot of folks who have mentioned that they have wild prescription changes and that their vision changes dramatically. So, that's upside down. Let's go back to this way. So when the blood vessels leak, if your A1C or your blood sugar is like a roller coaster, that changes your vision. That can make things very devastating for your vision, and that can cause a lot of health-related problems because it's inferred that when we look at the blood vessels inside the retina, that's an indicator of what's happening throughout the entire body, which is scary to think about. Organs, brain, heart, you name it. That can all be indicated for what's going on within the retina. So it's important to get your eyes checked, it's important to get your eyes dilated, and it's important to have your report sent to your physicians that are monitoring your diabetes. And again, this goes for type 1 or type 2. The data out there suggests that if you have had diabetes for 10 years and you're not monitoring it very carefully, that's what's going to cause these blood changes in the retina. That's what's going to cause things to leak. That's what's going to cause prescription changes. That's what's going to cause you not seeing as great. These are pretty important changes that can impact your health, that can impact your vision, that can impact the way that you see. that can also impact your glasses or contact lens prescription. And if there's enough leaky blood vessels, specifically under the macula, the specific component of your retina that's responsible for your best central vision, whether you're looking far away or reading up close or trying to see faces or look at that road sign down the street to make the right turn, that can lead to some issues if there's blood underneath there, because eventually that blood can creep up into the retina and can create what's called wet macular degeneration. You don't always go from dry to wet. You can go straight into wet sometimes due to diabetes. And when there's enough blood pooling under there that causes it to rise up, then you can have some issues that might require injections, might require laser intervention, different things to calm that retina down. But it's scary to see some of the changes that can exist. The best thing you can do for your eyes' health, your body's health, your blood sugar and your A1C's health is to keep it as consistent as possible, because the changes in the blood sugar or the A1C can affect the blood vessels, put too much stress on them in the retina, because those blood vessels are very, very tiny in the retina. And when there is a high amount of stress exerted on them, they leak, they don't function, they don't bring oxygen in correctly, and that can cause all kinds of vision problems. So to keep things as consistently as possible, work with your doctors that are monitoring this, as well as your eye doctors that are monitoring this, so that everyone can be on the same page. Which is why it's extremely important to be connected to your doctors, to listen to the recommendations, to trust your doctor, to have that relationship, ask the questions. Because I ask my doctors questions when I go see them. Now, I don't have diabetes, but I like to ask a lot of questions. I like to be able to make sure I have an understanding of what my doctors are recommending, what they're telling me, what they're advising me of. And it's that trust, it's that relationship, it's that understanding, and that educational insight and information. Because there's a lot of times where a lot of people in exams will ask me really good questions, and we need to unpack some things that need to be discussed a lot of times. So that's extremely important as a healthcare provider, as a patient, anybody affiliated with health, that questions be asked, that they be talked about, that things be learned that you didn't previously know, to help take better care of your eyes and take better care of your vision, take better care of your prescription. But it's kind of scary, some of the changes I've been seeing recently in folks with diabetes, whether they're diligent and we don't see a lot of changes, or if they are not that diligent and there are a lot of changes, because that affects the whole body. It affects the way you feel. It affects the way you function. It can affect your brain, because if all this stuff's happening in the retina, imagine what's going on in the brain. Imagine what's going on everywhere that can impact you. This is why some people have appendages and toes and different things amputated, because there is a necrosis of some of those appendages and blood vessels, because there's just so much inflammation and damage that it has to be severed to save the entire rest of the foot or whatever it is, basically. But back to the eyes, is that they're very small pinpoint dots that can start up. But if you can be proactive and get an early indication from your eye care professional, optometrist or ophthalmologist about what's going on, it can make a pretty huge difference to save your eyes and take care of the rest of your body. Blood pressure can have the same impact on eyes as blood sugars, diabetes, hypertension, different things. So blood pressure, again, going back to the inconsistency nature. If your blood pressure is up and down, going crazy constantly, that puts too much stress and pressure on the blood vessels where they can burst. They can cause a massive leak in the retina. It's like a pipe bursting, a water pipe bursting under your house, apartment, wherever. Same thing happens in the retina. Whenever a vein or an artery bursts, it leaks everywhere. It can cause the retina to think that it's choking and it needs to grow new blood vessels if it's been there long enough. And there's certain things certain specialists will need to do if that happens to get it fixed. But if you can be proactive about it and catch it early before it gets to that point and keep your blood pressure as consistent as possible, that's what's going to be a huge help. That's what's going to make the difference in your vision. That's what's going to help you not have a fluctuating, rapidly changing prescription that you could use 20 different glasses or contact lenses prescriptions for. But your blood pressure can be low, your blood pressure can be average, your blood pressure can be high, and if it bounces anywhere between those three ranges, that's what can give you the problems with hypertensive retinopathy. There's diabetic retinopathy. All of this is connected to the blood vessels. All of this is connected to the way that it helps you see. But again, the blood pressure thing can happen in the brain, it can happen in the heart, it can happen everywhere that there's major organs But the eyes are the first place that we often detect this a lot of times, because the blood vessels are so small and require a high amount of oxygen and carbon dioxide that there's changes that take place there we can observe. It's the only place in the human body that we can observe blood vessels in their natural setting without cutting open skin, without any type of special imaging or anything like that. We literally use, we call it a slit lamp, but it's a microscope, a little tiny beam of light pushed through what's called a condensing lens. You've probably seen this when you've gotten your eyes checked by the eye doctor. Kind of as a little round looking lens like this, basically. And they hold it up and let that light pass through. And that's where we as professionals are trained to observe, diagnose, and detect anything that's going wrong with the retina or the blood vessels or the health of the overall eye. And to see blood vessels in their natural setting gives us an indication for how the health of the person is. It's pretty amazing to watch. It's pretty amazing to look inside the eye to where it never gets dull for me. I always enjoy it because it gives me a better insight and understanding as to someone's health and what their health is doing. Going on blood pressure, back when I was in school, there were several times when somebody would come in for an eye exam and they may have not felt that great, or they felt nauseous, or they felt dizzy, or they didn't feel like themselves. And we took their blood pressure, and their blood pressure was through the roof, like 200 over 100 or something crazy like that, where we needed to call the ambulance. And this again, them coming in for their eye exam, we would need to call the ambulance and then have the ambulance take them to the hospital to lower their blood pressure. And a lot of times we're called primary eye care specialists, like primary care doctors of the eye. That we're often on the front lines to detect something. And sometimes some people aren't feeling the greatest and need additional help. But I can't talk. They may not be thinking about that when getting their eyes checked. But that's why we as professionals are trained to look for all of this stuff and to be able to help take care of people the way they should and the way that they need to be. Because there's a lot of things that a lot of people don't understand about the eyes, even in healthcare. And there's a lot of things I don't understand about other areas of healthcare. But if we can help each other out, that helps take care of everybody. There are many other health conditions, autoimmune conditions, different things that impact the blood vessels that I'll cover in later videos. But those are just some of the few, specifically diabetes and blood pressure, that can impact your vision and flip your world upside down and needs to get changed to make healthier life changes in order for you to see better, feel better, think better, and live better. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. I'm Dr. Bryce Effington. I'll see you next time.